I absolutely see this phenomenon where patients are just really reluctant to take more medicine, right? Now there are some that are, very open to it. Some that, you don't have to really necessarily convince very much. But there's a pretty sizable chunk of the patients that we see that, are very, very suspicious or reluctant or hesitant to start on any new treatment. And there's absolutely a need for more patient education. And that kind of, takes me into the next important point that question brought up, which is patient education. I think there's just this really big overarching need for improving education across the board as it relates to Parkinson's, with patients and with healthcare providers alike. But especially with patients, I think we don't do a good enough job as a whole of explaining to patients what Parkinson's disease is. What are the causes of Parkinson's as far as we understand them to be? How do we treat Parkinson's? What's the treatment even supposed to do for you? I can't tell you how often patients come in, saying, yeah, I saw a neurologist, they told me I have Parkinson's, said take this pill 3 times a day, and they walked out the door, and that's it. So it's a huge need, and obviously, some patients get more education than others, but there's absolutely a big need across the board for education that will help us communicate better, right? So it'll help neurologists and other healthcare providers communicate better with their patients and be able to understand, what good on time is. What's the medicine even supposed to do for you, right? Why isn't it helping my tremor? Why do you think it's helping me when I don't see any, difference, right? So bridging that gap. And then, the third thing that I thought of when you asked me that question is, what, in addition to patient education, can help bridge that gap, and what topic I haven't really heard much discussion of, and that's wearable technologies. I think there's a really, really cool, interplay between, technology and medicine that is happening, and I feel like movement disorders in particular is really well positioned to take advantage of that. So wearable technologies are being investigated for their use in helping us understand how our Parkinson's patients in particular are doing. There are various companies out there doing really, really excellent work. Everything from the common Apple Watch that already has built-in sensors that can be used and leveraged to help us with patients, to proprietary wearable devices that are specifically tailor-made for this purpose that are being developed. I think there's absolutely a lot of potential there, and helping us understand better how our patients are doing and how do we make adjustments to help our patients do better.